stimulate those. That's why in the last part, you grab the armpit. You grab the armpit from the lateral side. In other words, outside, you pull inside. So you rub against all the lymphatic vessels, the arteries and the veins, both sides. So when you use the hand, the other side, you pull from the inside to the outside. You pull from the outside to the inside. When you grab it, you know, there are lymph nodes here. Especially, you remember people with breast cancer, they will immediately check the lymph nodes here to see whether the lymph nodes are infected. If it's infected, then the cancer has spread from the breast to other parts of the body. You call it secondary cancer by that time. So when you massage this area, it means a lot to the person whose circulation has been quite slow or stagnant. So when you do that, the person is going to feel different. Okay, you can do that. Now, of course, there are other treatments when they ask you to beat your armpit 100 times a day. Have you heard people saying that? Huh? But this treatment, you have to do that for that person. You can teach them the exercises to do that 100 times. You know, like that. Beat yourself here like that. Okay? These are the things that you can do for yourself. But as I said, for the treatment, we do it for the person to start him off, right? So that, as I said, these exercises that we talk about, the person can go home and do it for himself, or do it herself. Or somebody at home can help the person. Okay, you keep that in mind. That's why if you learn it, as I said, make sure you share it with people so that you can do it for them. And in the end, when you need it, they can do it for you.
Yes.
So this is give and take, you know. Okay, because as I said, if knowledge not shared, the knowledge soon dies.
Yes.
As I said, the knowledge can die with me. When I don't share it to you, it can die with me. What I know, nobody knows. Nobody can have a follow-up or keep that knowledge going. So that's why I really hope that the knowledge will stay alive. Now, I want one of you to come here so that I can demonstrate to you the leg side.
The leg side.
Okay? Whoever has a problem with the toes or leg or whatever it is.
Sciatica.
Nobody?
Pastor. Kanin, this one. Sige.
Okay. Take care of your shoe. Okay, I will do from her toes all the way up. The toes is like doing the fingers. Same. That's why I said this technique should not be hard for you to learn because we use the same principle. Okay? Okay. We have no pillow here. Do you like it? You have. You can take off your eyeglasses. Okay. Now I'm going to start with the toes, okay, and all the way up to her groin area. You can come nearer to see. You wash your feet this morning? Not yet. Just today. Alright. So you are relaxed? Okay. Nobody brought a towel. I thought I asked for towel.
Yeah, towel.
Okay.
Hand towel.
Now, you see, what I'm doing here is this. The same thing. So I join, I close, I open. Remember, the same principle. Okay? Close, open. Close, open. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. I pull, and let go. Close, open. You see, you have quite a bit of crepitations here. Just to join them. Crepitations are sounds when you apply pressure or you pull or you move the joint. There is a sound called crepitation. Pastilan.
Pas mo na.
Wa pagipol labuto na.
Ano nga, pas mo kumatiin ba?
Kung dili mo labuto okay lang. Basta lang.
Kamusta yun si Doktor?
So close and open, huh? 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So grab the toe, the first bone, pull, let go. So close, open, close, open, close, open, close, open. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Then you go back to the next joint knife. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So you grab her toe, go back down, grab the first joint, pull. Grab the next joint, pull, and then you let go. So now I push the circulation up. Okay. You see here, my thumb goes this way. I put the circulation up. I push the circulation up. Like that, right? I push the circulation up. I push the circulation up. Now, I can massage her bones over here by doing a rotation movement like that. See, I go up and I go up, okay? I go up to her ankle. So, I can move her circulation all the way up. Now, this one, I want you to watch very carefully. Because this part, a lot of people takes a lot of instruction in order to get it. So now I want to move her ankle. So you see, I grab her Achilles tendon here, this one here, and the tendons on top, the plantar side. I grab it tight. You see that? I grab it tight, okay? Now I do like this. I push her foot up. 1, 2, 3, 4, 5, and then I push down 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. So I have closed and opened these joints below and above. It's all closed and open, as I said, the principle. But how about the sides? The sides different. You see, I grab her foot like that. This hand, grab her foot like that. And then this other hand, I grab her ankle. I grab her ankle. This one, I move up and out. This one, I move in. So what am I doing? I close this one and I open this one. Right? So now after that, I change my hands. This one, I grab this side and my hand this side. Now, I am pushing this way. So this one is out and this one is up and in. See like that now? So I do this twice. You need to do it twice. 1. Hold it for 1. Then you do the opposite for 1. So you see the position of my hand and how I grab her foot, how I move it, I twist it. Watch it this way. And this one out, out. The opposite, I grab this one, up, out, this one, in. Okay? So you do it correct, because if not, then the effect is not there. Okay? So this one that I have done, so I have opened up her joint up to here. Okay? And when I do that, I move her muscles here, and I also move her muscles here. It will go up to the thighs too, because the joints, they are what do you call that? The muscle attachments, they are affected. Okay. So any question up to this point? The toes is the same,
Same with
You can push the blood up just the same with your fingers, just the same. But the ankle, you want to close and open the ankle, you have to follow. You see your hand here, this one? I grab her like that. I do like that. I I twist, so to say, the medial side up, out, and the outer side in. Right? So it's opposite side. So now I grab her ankle, I push it in like that. So I will definitely open up this joint. Open. Okay, the opposite is like that. Okay, like that. See you see the movement? That's what you need to achieve. You hold it for a few seconds so that the fluids can have time to move and change. Okay? That's what you
Okay.
can do. So that is as far as the one foot is concerned. So now, with her leg, how do I move her blood up? I can do that by doing the same thing like the arm that you see me do earlier. I can do that. I can move her blood up. Okay? But the more effective one, this one you can do 2 times with one hand. You can do 2 times on the other hand. That is only on the upper side. But how about down here? Okay? When it's down here, what you can do, there are 2 things you can do. One, you see my hand. I grab. Can I expose your leg a little bit? So that I can see your muscle, right?
Yeah.
So you see, I grab her muscle like that. Start from below. Like that. You see here, I grab the muscle. The other hand will have a follow up. Like that. The other hand follow up. So where is the direction of the blood?
Flow.
Going up. You don't start from here and go down. No. Because you are not helping the circulation. What we want to move is the circulation up so that her arterial supply of the blood coming down will have no obstruction. Because it's just like the highway, but if you open the highway down there, the flow of the traffic will be normal. See? But if you don't open up, if you do not open up, then the blood supply coming down will be delayed. And that is what can cause varicose veins, tiredness of the leg, cramps, you can name it. It's all because of circulation. You know, so you can do like that, Your hand, grab, and you grab. So you find that it's very tight here. Even the muscles here, the blood on the top of the muscle, it will be affected. It has to move. So I will go up this way, and then go toward her popliteal area and go up one more time. So definitely I push the blood all the way up to your thighs already for sure. It cannot be staying down here. So the exchange of blood flow will improve when I do that. Okay? Now, I told you a while ago, I grab like that. Like that, right? Successively going up. The other one, I can do it is also like that. See, this is my finger. My other fingers and my thumb on top. I can also grab her like this. You see now? Then the next hand, like that. And like that. Like that, all the way up. Okay? All the way up. Like that. Okay? So you can move the blood one way or 2 ways. Or you can employ 2 ways to be effective. So you can do that. So now a while ago I move a blood this way, right? And then this way, this way, this way, this way. So when it comes to the popliteal area, the blood vessels are a lot, the nerves are also a lot. So what I do is from this, sorry ma'am, I grab like grabbing your armpit, ganina. I will grab it like that. 2, 3, 4, 5. I can grab it also on the other hand. 1, 2, 3, 4, 5. Okay, the other one is I can do it this way. You see what my fingers rotating? Can see that? And opposite.
Clockwise, counterclockwise.
So there is no way that you have a clogging of the blood down there. So as I said, if you do it systematically, in one treatment, maybe the patient may not feel the improvement a lot. But if you do it the second time, the third time, since you have opened it up again and again, the flow will become better and better. The patient is going to feel better and better. So as I said, diabetic patients, the circulation to the legs is very bad already. So if you give this treatment, but for a diabetic who have been suffering from diabetic long time, you cannot apply so much pressure like her. I think she's like more like a normal, healthy person. That's why I can afford to grab her legs so tight. But a diabetic, you cannot grab so tight. Because the blood vessels of a diabetic is very fragile. Okay, so you just give medial lumbar. And the pressure, and then more slowly you grab but more gently before you go deeper and deeper. You see my movement, you can feel it, right? Gentle to begin and then deeper and deeper like that. So for diabetic, you need to consider the longer the diabetic, the more careful he needs to be at. Because her blood vessels or his blood vessels are more fragile already because of the diabetes. Okay, so now I have finished her here. So what am I going to do when I reach her knee? There are a few things I can do with her knee because a lot of people have knee joint pain. Right? The knee joint pain has to do with the kneecap and has to do with the tibia fibula and the